Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate as of May 4th, 2023. As I do about once a month, I want to do a quick update on COVID and other infectious diseases. So this week, I'm only going to focus on COVID and address two questions that have come in. The first is the pandemic over? And the second is, how should I interpret case reports in my area? Both of these are based on things that people are asking right now. Now, the question about why, is COVID over is based on this idea that we have now said that the national emergency is ended. And folks understand that to mean that there is no longer a national emergency around COVID, which in some ways is true. What the Department of Health and Human Services has said is that having implemented the largest adult vaccination program in the history with 270 million Americans receiving at least one dose, since the peak in January 2022, reported cases are down 92%, deaths are down over 80%, and hospitalizations are down nearly 80%. So the pandemic appears to be burning itself out. So what does this mean for you in terms of the end of the national emergency? Well, functionally, not a great deal, other than you may have to pay for home test kits and lab-based tests. Vaccines may eventually cost money for those who don't have health insurance. Once the vaccines that have already been purchased are used up, pharmaceuticals should remain free again as long as the federally purchased supply lasts. Hospital data reports and so on may be reduced. The Kaiser Family Foundation has a long list of things that will likely change as a result of the end of the emergency. And I've put a link here, or you can look it up. I'm not going to go through all of them. So is the pandemic over? Well, of course, the answer is no, it is not over. The pandemic aspect of it may be over, but the disease is still spreading widely. If you look at deaths in the United States, you can see that for the past year, we really haven't had the kind of spikes that we saw in the past. And in fact, over the past year or so, there's been a slight decrease, but the number of deaths hasn't gone away. It's still running around 100 deaths a day. If you look at hospitalizations, the pattern's a little bit different in that we saw these January spikes, but we've also seen a post-July spike. But the last two have been way below the previous ones. So again, hospitalizations are not as dramatically down as deaths, but both are down considerably. And so what we've seen is that the spike pattern of the pandemic appears to be blunted, but there are still 100 deaths or so a day, which means COVID is still a top 10 leading cause of death in our country. It may have become an endemic disease. That's one that exists in a community year-round, or at least in a consistent level, as opposed to a pandemic, which is a disease that's exploding in multiple countries at once. Some have compared it to the seasonal flu. I'm not a big fan of that because the pattern is actually quite different. If you look historically at the seasonal flu deaths, you see these annual spikes, just as we've seen with COVID. But what you see between each spike is virtually no deaths. We simply don't have a lot of deaths from flu all year long. Whereas if you look at COVID, you can see this long tail. We've had the annual or the semi-annual spikes, but it isn't seasonal in the same way flu is. But it may be comparable to flu in the sense that many people expect that we'll need a periodic variant-specific vaccination or booster, so that each year, as we do with flu, we'll get a new COVID shot. We may or may not go there. So if you ask me what's going to happen, I would say, as I always do, no one knows. This is unprecedented kind of thing. But based on the last year, I tend to believe that we'll see a consistent but hopefully decreasing number of hospitalizations and deaths. There probably will be some seasonality, especially in the wintertime. Probably in some future years, as we get new variants, there may be a number of deaths that go up, as just what we don't see with flu. Flu typically averages about 36,000 deaths a year, but it may go as low as 10 or 15, up to 100,000 or so. And then we'll probably need periodic vaccinations and boosters, but no, it is not over. The other question that has come in from a couple of folks is, hey, I've seen a report in my county that says my case reports are up, or the number of positive cases are up. And, they say, well, increased number of cases, increased percent of positive tests. And I always say the same thing for the last 3 years, which is I'm not a big fan of using cases. And people sometimes ask me why. And so let me give you a quick explanation. Let's take a hypothetical community of 100 people. And let's say in this community, there are 4 people with COVID who are sick. They have the symptoms, cough, fever, they don't feel good. And let's say there's 6 more that have some symptoms, but not really sick. Again, a lot of you probably have had COVID in the last year or so, weren't nearly as sick as you might have been early on. And let's also say in this same community, there are 10 people who have symptoms of cough, cold, fever, headache, and so on, but they're not COVID positive. Okay, so that's your community. Well, obviously, if you don't do any testing, you'll have no cases and you'll have a 0 positive test rate. What if you test the people with symptoms? Well, then you'll find 4 cases and you'll have a 29% positive test rate. What if you test everyone? Well, then you'll find 10 cases, but only have a 10% positivity rate. So here in the same community with the same amount of COVID, you could have 0 cases or 0 positive tests, 4 cases or 29% positive test rate, or 10 cases, and basically anything in between, all dependent on how you choose to test. So testing for cases, unless you do it systematically, which we did not do in the early part of the pandemic, which probably in retrospect was a mistake. We should have been doing regular periodic tests, but we weren't. So in my case, in my system, from my point of view, looking at cases doesn't help us very much. So I always suggest look at hospitalizations and look at deaths. There are a number of ways you can do that. I find the New York Times report to be useful. They show maps based on the CDC. You can see at the top hospitalizations, vaccines, all-time cases, but you can also drill down and see the number of hospitalizations, for example, by state. So is the pandemic over? No. It's still a top 10 cause of death, but it is stable and hopefully coming down. And how should you interpret case reports? With some degree of skepticism. Look for data on hospitalizations and deaths. Please feel free to share this video, and all the ones we've done in this series with anyone who might be interested. Thanks as always to Dara Young for editing, producing, adding captions, and posting our videos. And if you have any questions or comments, please let me know. I've tried to respond to many of you by return email. Sometimes, as in this week, I'll incorporate your questions into the weekly update. But I'll probably be doing less COVID coverage than I've been doing in the past, unless we see something change. So I feel free to let me know if there are other public health issues you'd like to hear about. So until next week, please be well.